Yes, so yeah, very good evening once again. So today we are here to discuss the journal physiology important questions MCQs for our first year students. So first of all, I welcome you to the discussion of physiology. Myself, Dr. Kamal, and yeah. So as you know, today is the discussion of journal physiology, first class for today. So which books to follow? So I would advise you to read Guyton to understand the topics, especially in the new edition. Now the chapters have been really concised, and they have given an excellent way the boxes as well, which gives the very important data and information, right? So, and also I would like you to tell that you should read after Guyton Genong as well. Coming to Indian authors, there are various books, and that depends which was being followed in your respective colleges, but I would advise you to read Guyton, right? And that's a must read, right? It's a textbook, it's a must read. There are short chapters now. Start reading 1 or 2 chapters every day, make an habit, and read up the same topic immediately from Genong so that you get hang of the important topics and subtopics. So let's begin with the first question. In a clinical study to study actions of the unknown test solution on the RBC, right? 1 ml of heparinized blood 1 ml of heparinized blood is added into 100 ml of test solution and mixed. Results show that yes. चार्ट में कुछ लिखो, मुझे कुछ दिखाई नहीं दे रहा है चार्ट, ये भी कुछ लिखा ही नहीं किसी ने। और नोटेबिलिटी का मेरा स्क्रीन क्यों कट रहा है आज?
नहीं सर, वो वापस ही आ रहा है सर, उस पे हम देखे एडुकेटर में देखिएगा, बच्चे डाल दें, मैच डाल दें आपको।
नहीं, मैं तो नहीं देख रहा। अच्छा, ओके, ठीक है। नहीं, बट कट क्यों रहा है?
नहीं सर, एडुकेटर में देखिए, उसको वो पूरा आ रहा है।
अच्छा, ठीक है, ओके। नहीं, यहाँ भी कट रहा है ना, देखो ना सामने।
नहीं सर, वो उस पे नहीं कट रहा सर, कट नहीं रहा, कुछ नहीं कट रहा।
ठीक है, ओके। Yes, so sorry for that. Okay, Khunt and Krish Jayant. Okay, we'll just see. So basically what the question is about, that here says A. Okay, let's find out the answer. So basically, first of all, remember, whenever we say the tonicity is the term used always with respect to plasma osmolarity, right? So here what we are doing is, remember, in most of the universities you will be getting the MCQs now. In some universities there are 10, in some there are 20, so you have to be well versed with the question. What we are doing here is, so RBCs are placed into some test solution, right? Let's say this is the representation of the RBC. So I have 3 answers with me. 2 people are saying C, 1 is saying A, right? Let's find out the correct answer. So basically this is some unknown solution in which RBCs are placed, right? RBCs are placed. Now what happens is, the RBCs, as soon as they are placed, they immediately swell and burst. They swell and burst. That means this is the swelling of the RBC, and then eventually it bursts, right? It ruptures. Now when will the swelling of the RBC occur? When I am placing it in what kind of solution? That is my question. So please understand, if I place the RBC in an isotonic solution, then no change in volume will happen. Now which solutions are isotonic? Which have same osmolarity as plasma. So here we are assuming that the intracellular osmolarity is 280. That also I have given you in the question. So 140 millimole per liter will become actually 280 milliosmole per liter. So A is not the answer, because A is an example of isotonic solution, right? Here, why did I multiply by 2? Because sodium chloride contains 2 dissociable particles. One is sodium, one is chloride. Now 280 millimole of sodium per liter of sodium chloride will be how much? 560 milliosmole per liter. This becomes hypertonic, right? So this will make my RBC shrink, something like this. And now we have two options, 140 millimole per liter of glucose versus 280. Remember, glucose normally is non-dissociable. So this is same as 280 milliosmole per liter. But 140 millimole of glucose, which is the correct answer here, is same as 140 milliosmole per liter. That means I have to place the RBCs in not isotonic, but because they are swelling and bursting, the solution must be hypotonic, right? And there is only one solution which is hypotonic here, which is option number C. So I think Heer and Khund gave me the correct answer, right? Wonderful. Krish, Khund, Krish and Heer gave the wrong answer. Remaining people gave the correct answer, right? So I hope you got it correct. Let's move to question number 2. So I have tried to give you a lot of calculation based questions in this discussion, because calculation based questions and topics should be on your tip. Using the following data, calculate the filtration coefficient for the capillary bed. Plasma colloid osmotic pressure is 30 millimeter mercury, capillary hydrostatic pressure is 40, interstitial colloid is 5, interstitial hydrostatic is 5, rate of tissue fluid formation is 150, right? So how will I check for this one? What should be the answer? Remember, this is based on a concept of forces known as Starling forces, right? Starling forces. Okay, Sutaria is giving us some answer. Fine, Sutaria, let me solve for you. Starling forces govern the pressures which are the pressures which govern filtration or reabsorption across the capillaries, right? So basically we call them forces, but they are actually pressures. First pressure is P cap, which is known as hydrostatic pressure in the capillaries, which is trying to push the fluid out, right? So which one is the hydrostatic capillary here given to you? This is 40. So let me write 40 over here for you. This is given as 40, right? Then I have given you the plasma colloid osmotic pressure, which is, let's say, oncotic pressure in the capillaries, which is, remember, a pulling pressure. It is trying to pull the fluid back from the interstitial fluid. Its value I have given you as 30. Right? So it is trying to pull back 30. Then I have the interstitial hydrostatic pressure. Look at this carefully. Interstitial hydrostatic pressure is 5. It is trying to push back the fluid back into capillaries. So this is 5. This is 30 and 40. And finally the last one is interstitial colloid oncotic pressure, which is trying to pull the fluid out with a pressure of 5. Now can you solve this for me? Yes, you all should be able to tell me the answer, that net filtration pressure will be equal to, tell me which ones should I add, which two are acting in the same direction. Hydrostatic in the capillary plus oncotic in the interstitial minus oncotic in the capillary minus hydrostatic in interstitial. If you solve this for me, you get the first answer, which is 40 plus 5 minus 30 minus 5. This answer should be 10 millimeters of mercury. Now a lot of people go wrong here and they mark the answer as A, but you have to be vigilant and you have to tell me by looking at what I am asking you. Rate of tissue fluid formation is 150. Yes, rate of tissue fluid formation is Kf into NFP. This is given as 150. Now, if the NFP is 10, then naturally I was asking you Kf. The answer would be 150 upon 10. That means 15 ml per minute per millimeters of mercury. So Starling forces is a very important short note by the MCQ, and those who ever have given me the correct answer, they are clear with the concept. It's a very, very important question, right? Must know, very important question. Moving to question number 3, this is also confusing to many. A neurotransmitter is activates its receptor on the ion channel of a neuron. Once the channel is open, the ions move through the channel down their concentration or electrochemical gradient. That means higher to lower concentration. Which of the following best describes the type of channel and mechanism of ion transport? Please understand, suppose this is a representation of the membrane and this is, let's say, a representation of the channel. Now as this is the receptor and this is the ligand. As the ligand binds to its receptor, the ion is moving like this, right? This is the movement of the ion. So when the ion is moving from its higher to lower concentration, no, the answer is not B. That is why this question is important. It is a ligand gated channel, but movement of ions through the channel is simple diffusion, not facilitated. So that is why this question is very good and important. Please remember, facilitated diffusions are the ones which require carriers, something like glucose transporters. In carriers, what happens is, if this is a representation of a carrier protein, then once the substrate, let's say glucose, binds to its carrier, suppose carrier is like this, it will change its shape and then only the glucose can enter. That means carriers undergo a conformational change. Conformational change would mean something like this. It changes conformation and then pushes the glucose. So channel is not changing conformation. Channel, remember, always is an example of simple diffusion. Carrier, remember, is an example of facilitated. What is the difference? Basic difference: carriers, they undergo a change in conformation. Earlier it was like this, now it is changing the conformation to push the glucose or urea or amino acid, right? Facilitated diffusion. So moving to question 4, feedback systems is a very important topic from Journal Physiology as a short note for your exam. Which of the following statements represents or regarding feedback control is incorrect? You have to tell me the wrong statement. So most control systems act by negative feedback. Extremely correct. True. That's right. Absolutely true. Positive feedback systems usually promote stability in a system. This is wrong. This is wrong. Please remember, this is incorrect. This is false. In previous question, we are saying that the channels, the channels are either open or closed. When the ligand binds to its receptor, the ion is moving from its higher to lower concentration. So this is an example of simple diffusion. But carrier proteins which get saturated are example of facilitated diffusion. Carrier proteins undergo a change in conformation, right? But ligand, when it binds to a channel, the ions move from its higher to lower concentration through the channels. Channel is an example of simple diffusion. This is what I said. The positive feedback systems do not promote stability, rather they are destabilizing in nature. They are destabilizing in nature, or something known as vicious cycle happens. Vicious cycle. So this is actually the answer because it is incorrect. Generation of nerve action potentials involves positive feedback. This is true. Where have you studied it? Yes. Can you recall? Opening of voltage gated sodium channels causes depolarization. Opening of voltage gated sodium channels causes depolarization, and Depolarization now causes more opening of voltage gated sodium channel, which causes more depolarization. So what is this happening? This is called as a positive feedback loop, right? This will only stop once the voltage gated sodium channels close. Feed forwards control is important in regulating motor activity. This is very important. This happens especially in the role of cerebellum and cortex in control of movements. You will be understanding this better in central nervous system physiology, but I think you have a vague idea that cerebellum is also involved in planning and programming of movements. So suppose I want to shake hand with one of you if you are sitting with me in a face-to-face class, then what will happen? Or I want to drink water from this water bottle, then what is going to happen? My brain is, cerebellum is sending the signals to the cortex. How much hand should I take out so that I am able to grab hold the bottle? This is the meaning of the feed forward control. Another important term for feed forward control is anticipatory control. Anticipatory control. That means it happens in anticipation. Then another calculation based topic, very important for the MCQ for the exam. Blood is transfused into a patient whose baroreceptors are not functioning. BP in this individual increases from 100 to 150. Baroreceptors are basically pressure detecting receptors which help us to detect the blood pressure. Again, this will be talked in detail in cardiovascular system. The same volume of blood is later transfused into another individual whose baroreceptors are functioning. Increase in BP in second individual is only 100 to 125. What is the approximate feedback gain of the arterial baroreceptors in the second individual when they are functioning normally? Yes, I'm happy to see some correct answers. That's wonderful. Remember two other important things as well. First, let's solve this question. Gain is correction upon error. Now please understand, in the correction in the first case, when it is working, then what happens is, in the person it is working, I am going from, normally it is when they are not working, we are going from 100 to 150. But when it is working, then it is coming back to 125. But the problem is, even between 125 and 150, there is a error. So how much correction has been done? 125 minus 100. But how much error is still remaining? 125 minus 150. That means what should be the answer? Plus 25 upon minus 25. Yes, everyone is correct, and this is considered as a tough question. So if you are giving me correct answer to this one, that's wonderful. One more important question here, very, very important, I would say. Anybody who will like to tell me which is the only system in the body which has infinite gain? Yes, always minus answer. Very good. Anyone who will tell me which is the only system in the body which has infinite gain? And this will tell me that you are reading Guyton. Yes, infinite gain. The only system which has infinite gain, infinity. The gain is infinity. That means the error is 0. 0 error. Anyone who will tell me the answer, or should I write it down for you? Very important MCQ, must know after today, don't forget it. Role of the kidneys in correction of the extracellular fluid volume. So kidneys correct the error in the blood pressure very, very slowly, but they do almost 100% correction or 0 error. 0 error means if you divide something by 0, the gain is going to be infinite, right? So this again will be dealt in detail in cardiovascular system. I can give you a hint that here we are talking about a process known as renin-angiotensin system, pressure diuresis, pressure natriuresis, right? More will be discussed in cardiovascular and renal system. But remember, this is an important MCQ which can come in your exam, so you have to know. In your semester exams, they can ask you this. A new drug is developed. This you should give me the correct answer. A new drug is developed that blocks the transporter for hydrogen secretion in gastric parietal cells. Which of the following transport process is being inhibited? So in the parietal cells, we have the pump known as hydrogen ATPase pumps. So I am giving a drug which is inhibiting this one. Can you tell me the answer now? Yes, wherever you see ATPase suffixed or at the end of the word, it is always primary active. That means ATP used directly, direct breakdown of the ATP. ATP is used directly, right? So absolutely correct. This is primary active. Remember, primary active is also written as first degree, primary active, right? Moving on to question number 7. Solutions A and B are separated by a membrane that is permeable to urea. Solution A is 10 millimoles of urea, B is 5 millimoles. If the concentration of urea in the solution A is doubled, then the flux of urea across the membrane will be. Yes, this is another important question where I am asking you an important law of diffusion known as Fick's law of simple diffusion. Can you recap something? Yes, J is equal to minus D into A into delta C upon delta X. Remember, J is the rate of diffusion. Minus simply tells me that the solute is moving from higher to lower. A is the area, delta C is the concentration gradient, delta X is the thickness of the membrane. So let's try to understand the question. I am only interested in rate of diffusion when my delta C is changing, right? So first find out the normal J. The normal J is, delta C normally is 10 minus 5. Remember, remaining all the things are same. But now in new J dash, new rate, I want to know what has delta C become. So please understand, now the new delta C dash is, I am doing double of the solution in A. That means 20 minus 5. Yes, and I know that people get wrong here. That is why this question is important. This is normally 5. This is 15. So how much faster the diffusion has become? The answer is actually triple, not double, right? So the answer was triple and not double. But I would not say that you are the first one who has made this mistake. A lot of people give the answer as double, right? So it is not double, it is triple. Another calculation topic, very important, based on the measurement of body fluids, one of the very important topics of journal physiology. Remember, transport across cell membrane and fluids. These should be on your tips. They are the most important topics. As a part of an experimental protocol, 10 gram mannitol is injected into a volunteer to determine ECF volume. 10% is excreted in the urine as determined by urine analysis. After waiting for sufficient time for equilibration, concentration of mannitol in ECF is 90 mg per 100 ml. What is the volume of ECF? Can you solve this for me? Yes. This is based on, yes, dye dilution principle. This is based on dye dilution method or principle. Yes, I can see some correct answers. Q minus E upon C. What is Q? The amount of dye injected. What is E? Any amount of dye which is excreted. What is C? Concentration given. Let's find out the answer. So when I try to solve this, I will realize that 10 gram mannitol was given. 10% of mannitol, that means 1 gram, was excreted. And my concentration is given in milligram to confuse you in the units like this. If you solve this for me, this becomes 9000 milligram upon 90 milligram into 100 ml. And now I think things get easy. The answer would be 10,000 ml or 10 liters, right? 10 liters. So the answer is actually 10 liters. So remember, this is an expected question in the semester exams, in the final your professional exams also. Be aware to change the units properly and also subtract any amount which has been excreted by the person. Question number 9. In a person weighing 60 kgs, the volumes of ECF, plasma and interstitial fluid volume are respectively. That's a relatively easy one. If you could give me the answers. ECF is how much? Yes, ECF is 20%. 20% of 60 kg would be 20% of 60. Yes, 12 liters. Then plasma is 5%. Now I don't need to solve again. 5% of 60 would be 3 liters. Interstitial fluid 15%. 15% of 60, 9 liters. What are we doing here? 3% of 60. What are we doing here? 15% of 60, right? So absolutely correct. The answer is 12 liter, 3 liters and 9 liters. Wonderful. Yes, one liner but very important question. Where is the potassium maximum? Potassium is maximum in. Yes. Where is potassium maximum? Please remember, the total amount of potassium in my body is 55 milliequivalent per kg of my body weight. Out of this, 98% of the potassium is in your ICF, inside the cells, and only 2% is in ECF. That means the answer is intracellular. So 98% of potassium is in ICF. Also remember, in the ICF also we are saying mainly in the muscles, right? No, it is not plasma. In the plasma, in fact, it would be very less because ECF is only 2%, right? ECF is only 2%. So we say maximum potassium, remember always 98% is inside the cell, intracellular. Where is the potassium maximum? Which tissue? Muscles, right? Very important question. When solute is moving in one direction, when solvent is moving in one direction, the solvent tends to drag along some molecules of the solute. What is this process known as? Very interesting question, important one as well. So this is, let's say, my representation of the proximal convoluted cell. This is a representation of the PCT. This is the luminal brush border. This is the basolateral side, which is towards the blood vessel, right? Now, this is a representation of another PCT cell like this. What am I asking you is that the water is dragging the ions and water are moving together like this into the blood vessel. What is this process known as? Remember, as the name is suggesting, water carries the dissolved solutes and ions along with it. This is famously known as solvent drag. This type of transport, which I have just drawn the figure for you all, is famously known as, must know, paracellular transport. Paracellular transport. Paracellular transport. Para means pass mein, nearby, so in between the cells. But if the transport is occurring through the cell, this is known as transcellular. Transcellular, right? Through the cell. Like this is known as transcellular, right? So this is a very important one. Additional question I have told you, paracellular transport. This occurs through the junctions known as leaky tight junctions. Leaky tight junctions, right? Leaky type junctions. Moving to question number 12. All of the following transport processes follow saturation kinetics except. Saturation means that they will get saturated or their maximum rate will be achieved, right? Something known as transport maxima, T max, transport maxima, right? T max. So remember, any process which is carrier mediated will always show me a transport maximum when all the carriers get saturated. So facilitated diffusion is going to show. Sodium calcium exchanger is also going to show because it's an example of secondary active. So this is also going to show. Sodium coupled active transport is again secondary active. Remember, this is SGLT1, SGLT2. These are also going to show me, but simple diffusion will not show a transport maximum. The simple reason is simple diffusion does not require carriers. It is not carrier mediated. Because it is not carrier mediated, it will never get saturated, right? Moving to question 13. Yes, what are clathrins? Another important topic. You must see the video about the endoexocytosis. What are clathrins? Yes, clathrins. Very important one. Remember, clathrins are used in receptor mediated endocytosis, also known as specific endocytosis. Yes, absolutely correct. Specific endocytosis, especially useful in endocytosis of the LDL particles. LDL particles, and the recent books are telling us, especially the Genong, that it is also useful for NGF. NGF is your nerve growth factor. Nerve growth factor, right? Nerve growth factor. Nerve growth factor, fine. So it's a very specific receptor mediated endocytosis. Remember, for exocytosis we require a different family of protein. Please see the video, very important one. Snare proteins, synaptobravin, syntaxin, right? Those are the proteins required for exocytosis. And remember, both endo and exocytosis require a very important ion known as calcium. Very important question again, right? Both process require calcium, endo as well as exocytosis. All are examples of negative feedback except. Yes, tell me which is not a negative feedback. So regulation of blood pressure is a negative feedback. That's true. Regulation of blood glucose is also true. Why? Whenever your blood pressure is increasing, the body will try to bring it back to normal, right? So suppose you have increase in your blood pressure, what will I do? I will reduce the sympathetic stimulation. I will increase the parasympathetic, as we'll be learning in cardiovascular system. I will bring it back to, normal. Regulation of blood glucose and glucose level is the same choice. So maybe we can change one here. Regulation of the thyroid hormone levels. Now I have changed the option. This you can hopefully understand. If I have increase in T3 and T4, then remember, I will inhibit the hypothalamus. And the pituitary, thereby resulting in, yes, what is going to happen? Thereby resulting in less TSH, less TRH, and ultimately the T3, T4 levels will normalize, right? So which is not a negative feedback? Yes. What should be the answer? Clotting of the blood. Remember the mnemonic of the positive feedback, which I have shared with you in the video, right? Please look at that. Very interesting mnemonic. Just have a look at that video, right? All are true about sodium potassium pump except. All are true. Yes. Which one is false? Does it need ATP? That's true. Is it inactive at 4 degrees Celsius? Absolutely true. You should know all these facts. Is it electrogenic? Yes, true. What is the meaning of electrogenic? Just look at the pump. It is pumping 3 sodium out, 3 positive charges, but only 2 positive charges inside. If 3 positive charges are going out, but only 2 positive charges are coming in, I am having net loss of 1 positive charge. That means it creates a negative charge inside my membrane. So sodium potassium pump is a contributor to resting membrane potential, but it has no contribution for generation of action potential. So this is false. Moving to question 16. The equation which is used to calculate the magnitude of the equilibrium potential of a freely diffusible ion is which of the following? Yes. Think about it. Which one? Which is used to calculate the equilibrium potential. Whenever you say equilibrium potential, it is always the Nernst equation which is used to calculate the Nernst potential. No, it is not Gibbs-Donan. Gibbs-Donan effect is seen in cases of the impermeant protein anions, non-diffusible protein anions, which are present more in the ICF, less in the ECF. I'll write down Gibbs-Donan also for you so that you can see from the video. Nernst potential meanwhile is this. Nernst potential of an ion is equal to 2.3 RT upon ZF. This should hopefully give you the clue. Log to the base 10 C1 upon C2, right? This is the actually Nernst equation which is used to calculate the Nernst potential. Goldman-Hodgkin-Katz equation is used to find out the resting membrane potential. And Gibbs-Donan equation, Henderson-Hasselbalch is this one. pH is equal to pKa plus log to the base 10 A minus upon HA, right? This is Henderson-Hasselbalch. And somebody said option number A, so let me tell you Gibbs-Donan also. Gibbs-Donan equation is the potassium ion concentration on the side X upon potassium ion in the side Y is equal to chloride ion in the Y upon chloride ion in the X. What does it mean? The product of diffusible ions in one side of the membrane is same as product of diffusible ions on the other side of the membrane. This is Gibbs-Donan equation. Something like this. I'll quickly recap for you. Suppose this is the first part of the picture which is showing me the membrane. This is a cell. These are two sides. This is side X, this is side Y. Normally, let's say I have 10 KCl potassium chloride and 5 Ka minus. What is A minus? A minus is my impermeable protein anions. A minus are the impermeable protein anions. So now remember, the protein anions cannot diffuse from one side to another. So basically a special type of equilibrium is established, and at equilibrium the product of diffusible ions on both the sides should be same. So let us see what will happen at equilibrium. At equilibrium, this kind of picture is seen. On the side X now, I have nine KCl, right? I have 9 K plus, 4 Cl minus and 5 A minus. Over here I have 6 K plus and 6 Cl minus. you can very easily understand now that 9 into 4 is equal to 6 into 6. That means the product of diffusible ions in both the compartments at equilibrium is same. This is known as Gibbs-Donan equation. Why are the more positive potassium on the side X? Because remember, impermeable protein and ions will attract the positive cations. So more positive ions on the side X, intracellular side, and it will repel the negatively charged anions such as chloride. So more chloride will be on the ECF or side Y. Fine. Moving to question number 17. A solution contains 1 gram mole of sodium chloride per liter. Assuming full ionization of this compound, calculate the osmotic pressure of the solution. 1 osmole per liter is equivalent to 19,300 millimeters of mercury osmotic pressure. This is based on a law known as Van Hoff law. So basically the Van Hoff's law is like this: pi is equal to eta NCRT. I have already given you what is N. I only need this much, number of osmoles. That's it. I only need this much because I have given you the entire calculation that 1 osmole per liter is equal to 19,300. Now please understand, 1 gram mole of sodium chloride will form 2 osmoles per liter of sodium chloride. So answer would be 2 into 19,300. That's it. So the answer is 38,600. Please understand, if I change one word and write down 1 gram millimole, now you have to divide by 1000 and now the answer will become 38.6. So this is the answer for 1 gram millimole of sodium chloride per liter. This is millimole because in millimole you have to divide by 1000, right? So the answer is option number D. This I have given you in mole, not in millimole. If I give you in millimole, then please change the answer because you have to divide by 1000, right? That's important. Moving to question 18. Which of the following characteristics is shared by both simple and facilitated diffusion of glucose? Yes. Remember, both of them do not require, do they occur down electrochemical gradient? Is it saturable? Remember, only facilitated is saturable. So this is wrong. Requires metabolic energy. None require metabolic energy. Requires a sodium gradient. So which is the characteristic? Both occur from higher to lower concentration, right? Higher to lower. That's right. A is the correct answer. Moving to 19. This I think I've already told you now. You should be able to give me the correct answer. Gibbs-Donan equilibrium is based on which of the following? Gibbs-Donan equilibrium says, I have just drawn the figure, asymmetric distribution of diffusible ions. That means more potassium will be in the inside, less potassium will be in the outside ECF, less chloride will be inside ICF, more chloride will be in ECF. So asymmetric distribution of the diffusible ions due to the presence of non-diffusible impermeable protein anions. So what is the answer? It is based on intracellular proteins. And how do I calculate the distribution at equilibrium? By using Gibbs-Donan equation. Maximum contribution to plasma osmolarity is by, think about it, normal plasma osmolarity is around 280 to 290 milliosmol per liter. Which ion contributes maximum? Please remember, sodium contributes 270. along with its negatively charged ions such as chloride, phosphate and bicarbonate. So sodium is the correct answer. Please remember plasma proteins such as albumin, globulin, fibrinogen contribute minimum. Right, let's move to 21. If the extracellular concentration of calcium is 100 millimole per liter, intracellular is 10, what is the equilibrium potential of calcium? Cell membrane is freely permeable. Important question. First of all, I will use the NERST equation to find out the NERST potential's magnitude. Please remember, I have already told you this equation. Again, I am revising. In the numerator, I always take the higher concentration of the ion. In the denominator, I always take the lower concentration. Z is the valency of the ion. 2.3 RT upon F I have given you as 60 upon 2 log to the base 10, 100 upon 10. This entire thing reduces to 1. Answer should be 30, but plus 30 or minus 30. To calculate the sign, always focus on the movement of the ion occurring from which side to which side. That means ion is moving from where to where. So please understand, ECF calcium is very high, 100. ICF calcium is very less, only 10. So calcium starts to move from outside to inside. As the calcium is moving in, what charge will develop on the inside? Lots of positive charge. When the inside becomes highly positive, it will start repelling the calcium. So when the concentration gradient which is pushing the calcium in becomes equal and opposite to the electrical gradient which is repelling the calcium, think about it, what is going to happen? Both the forces are equal and opposite. Movement of the calcium now stops. As the movement of calcium stops, charge is always seen on the inside. What charge is developing on the inside? The answer is plus. So answer was plus 30. It is not minus, it is plus, because please remember, always according to NERST, the charge has to be seen on the inside of the membrane, right? So that was, it is an important question. Transport of glucose from the intestinal lumen into intestinal epithelial cell is an example of. This is an important question. Intestinal lumen. This is the intestinal luminal side. And now I am asking you, how will the glucose move from, if this is my intestinal epithelial cell, then please understand glucose moves along with sodium from the luminal side. This type of movement requires SGLT1, sodium glucose link transporter 1, which is an example of secondary active. If in the same question I ask you, how does the glucose move from the cell into the blood vessel? Please understand, the answer will change. Now the glucose moves with the help of GLUT2, glucose transporter 2, which is facilitated diffusion. But here I am asking you, how does the glucose move from the luminal side into the cell? So the answer is secondary active. This is not primary active. Primary active is direct breakdown of ATP. Please watch the videos once before you are participating in discussion. Please go through the video from the our lecture classes. Which of the following are best suited to measure the interstitial fluid volume? Remember, interstitial fluid volume is calculated indirectly. This is ECF minus plasma. So which indicator is used to measure ECF amongst them? The answer is inulin. Which one is used for plasma? Albumin. The answer is inulin and albumin combination. Heavy water is for total body water. So this is wrong. This is wrong. This option is wrong. This is wrong. Inulin and sodium, they are both for ECF. So this is also wrong. In fact, if I ask you which one is used to measure ICF, then please understand heavy water and inulin is used to measure total body water minus ECF. That means ICF. So another question, right? Option number A. Let's move to 24. 80-year-old man is brought to the emergency with complaints of, this is an interesting question, nausea, vomiting, clinical question. Lab analysis reveals significant hyperkalemia. Elevations of extracellular potassium ion will have which effect on the membrane, nerve membranes? Remember here what happens is, if this is a representation of my neuronal cell, then normally remember potassium inside is 150 milliequivalent per liter. In the ECF, potassium is 3.525. I am taking as 5. If I ask you a very simple question, what is the concentration gradient between the two? You will tell me delta C is 150 minus 5, 145. Now the potassium has increased from 5 to, let's say, 7. If the potassium increases from 5 to 7, what is the new delta C dash, concentration gradient? Answer is 150 minus 7, only 143. So please understand, in comparison to earlier situation with hyperkalemia, there is now decrease in concentration gradient. If the concentration gradient decreases, then less potassium efflux, less potassium will go out. If less potassium will go out, potassium is a positive charge, potassium accumulates inside. If the potassium accumulates inside, remember you are adding a positive charge to the RMP. What will happen to RMP? Think about it. RMP now becomes less negative, which is known as depolarization. So let's look at the option. This is the only correct option. Once there is depolarization, membrane becomes more excitable, not less excitable, more excitable. So excitability will increase. Sodium conductance has nothing to do here, and RMP cannot remain normal, right? So very important question. I've explained you the concept again so that you don't get confused. Finally, the last one, but very important one. Adenosine triphosphate ATP is used indirectly for which of the following processes? That means I am asking you which amongst them is an example of secondary active transport. That is the question. Please remember, accumulation of calcium by sarcoplasmic requires SARCA, which stands for sarcoendoplasmic reticulum calcium ATPase. It is primary active, so this is wrong. Transport of sodium from ICF to ECF, you very well know, 3 sodium, 2 potassium, ATPase pump, another primary active, right? Another primary active. Then absorption of glucose by intestinal epithelial cells. This is again, yes, think about it, we have just discussed. This is SGLT1, which is my answer here, which is secondary active. And the last one is wrong. Why? Because transport of hydrogen ATPase. ATPase means primary active. So which one is secondary active? Glucose absorption, right? SGLT1. So I hope the class was fruitful for the people who are attending it online with me, and remember to do these important questions, understand them again, and do the same topic from the video next time before you attend the online revision of the MCQs, right, or the class, right? Shall I take care for today? God bless you all, and once again many congratulations for joining the MBBS course and being the part of our fraternity. Now you have huge things to look upon, so work hard, right? The 1 month of the time is over, so now start studying, and your first term exams must be coming, right? So wish you all the luck, and in the video you have my number also, so please see from there. In case you have any doubt, you can WhatsApp me, right? Thank you so much, right? Take care. God bless you once again.